We turn now to Ontario, where 6 COVID-19 ICU patients from Saskatchewan will receive care. Dr. Michael Warner is the head of critical care at Michael Garron Hospital in Toronto. Thanks for taking the time today.
Thanks for having me.
Dr. Warner, how risky is it to move ICU patients nearly 3,000 kilometers to Ontario?
I think the risk to the patient is actually minimal. The transport paramedics who move patients in airplanes are extremely well trained, and we in Ontario are very used to treating COVID patients. So I think, for the families worried, we will provide their loved ones with exemplary care. It is difficult, though, to say goodbye to your loved one and have them get on an airplane and travel across the country. So I'm sure that there are a lot of emotions those family members are feeling right now.
I know that you are not responsible for transport, but what can you tell us about how that process actually works?
Yeah, so my training is not in transport medicine, but I can say that during wave 3 in Ontario, we transported patients in airplanes within our province, and it's quite common actually, because Canada is so big, to move patients vast distances for non-COVID related critical care. But it's done in a very safe environment with highly trained paramedics, and the hospitals will be ready to receive the patients, and it should be seamless. In fact, the transport time could actually be less than the transport time by land ambulance, depending on the distance that land ambulance would have to go.
All right, when you see the ICU crisis happening in Saskatchewan and then compare it to the current situation in Ontario, what do you make of it?
Well, at our peak in wave 3 in Ontario, we had 891 COVID patients in our ICUs. And at that time, we were moving 30 to 40 patients among hospitals within our province each and every day. When we look at the population of Saskatchewan compared to Ontario and look at their 85 COVID ICU patients today, that's equivalent to 1,075 in Ontario terms. I actually do not know how the teams are coping with such a deluge of COVID patients while still trying to keep the lights on for all the non-COVID related care that they're still able to do. Notwithstanding the fact that care is being rationed in other means because hip and knee replacements aren't happening, masses are not being biopsied, cancer care may not be delivered, lots of things are waiting, including transplants. So it's remarkable that they've been able to keep things together, but I suspect they're hanging on by their fingernails.
What capacity does Ontario have to take more of patients out of Saskatchewan if it's necessary?
Essentially limitless. We are such a big province with so many ICU beds, and I think actually moving 6 patients with a denominator of 85 COVID patients right now will make a difference, and we can definitely take more without compromising care to Ontarians or access to care for Ontarians.
Knowing Saskatchewan only has 135 ICU beds, period, does taking 6 people out actually take the edge off?
I think it does. I think that you can't anticipate what could happen in the province. There could be a car accident or some major trauma where you have a number of casualties all at the same time, which is why these transfers are in some ways proactive to create capacity in case there is a demand for either COVID patients, because we've seen the wastewater data that says that things happen probably at Thanksgiving that will lead to more spread, or non-COVID crises that require ICU beds. So I think that it will help. It would also help, I think, to have healthcare workers move to Saskatchewan so that patients didn't have to travel across the country. And I believe there's a call into the federal government to see if those resources can become available.
In your professional opinion, what do you think needs to happen in Saskatchewan right now and in the short term to take the pressure off our healthcare system?
In fairness, I'm not there, but I do speak to my colleagues who work in ICUs in your province, on a daily basis. And vaccination is really important, but it's not the only thing. I think Saskatchewan has 77% of its eligible population fully vaccinated. In Ontario, it's 83%. So not a huge difference. But right now in Ontario, where we have just about as many COVID cases as you do, we still have indoor capacity restrictions. And my understanding is there are no capacity restrictions in Saskatchewan. That doesn't make sense, especially when you have communities that have very low vaccine uptake, where there could be circulation taking place in these gatherings. And the mask mandate was just instituted, I think, September 17th. We never lifted ours. On July 11th, I think you lifted all public health restrictions. So I think restrictions on indoor gathering, and also telling the constituents and the electorate and the residents of Saskatchewan the truth about the situation. Like, this is serious. Monoclonal antibodies is not the way out of this. Public health measures are the short-term solution to get the hospital system over the hump. You should not titrate your public health response to capacity of the ICU, because if you do that, you will exceed it. And I think that's a really important message. And hopefully the leaders in Saskatchewan will communicate to the populace how serious this is, not to fearmonger, but so that people may adjust their behavior accordingly to reduce the spread of COVID-19 within their local communities.
Thank you so much for your time, Dr. Warner.
Thank you.
Dr. Michael Warner is head of critical care at Michael Garron Hospital in Toronto.